I've had a couple questions recently on concierge medicine and kind of styles of concierge medicine. I've had a few patients transfer over to my clinic that have come from other clinics, some that focus on one thing almost like a specialist would, some that focus on others. And so I thought I'd take a few minutes and just kind of break down the different types of concierge medicine. This is not an all-inclusive list by any means, but here are some of the ideas. In general, you have kind of concierge medicine, direct care, where you are 100% committed to paying for your medical care with a doctor. It would almost be like the equivalent of getting a retainer with a lawyer and committing there. So getting kind of locked in. But with that, you have different kind of levels of that. Sometimes you have a monthly fee, sometimes it's a yearly fee. And those prices can range dramatically depending on the provider's experience and focus points, but also what they offer within their clinic. There are some providers that have X-ray and DEXA scans and labs and almost like personal gyms within their clinic itself. And with those, they have a little bit of a higher rate, but everything's within the cost of the contract there. And so you get your labs all done in-house, no extra bills essentially. Some will even have kind of small pharmacies connected to them, though that's a little less common, depends on the state. So that's one option there. Oh, wow, just beautiful little bubbling brook, a little creek there. Oh, it sounds so nice. But you'll also see some of these clinics that are kind of all-inclusive like that, but they really just cover the office visits. It's kind of unlimited number of office visits. And then from there, they use other companies like LabCorp or Quest for their labs, for example. And that one's probably the most common because you don't have to worry about all the extra equipment and the maintenance and the certifications behind all of those. And it helps to keep the cost to the patient down because a lot of patients can then use their insurance at these other facilities and leverage their insurance. The negative would be is for those who have extremely high deductibles, or if they do not have insurance, then they're sitting there having extra fees. There's some positives and negatives within that. There are also concierge docs who do this all inclusively, and they have specialists essentially. So some will specialize in functional medicine only. They won't do kind of like we do at my clinic, where we do a lot of functional medicine, obviously, but we also do family medicine, primary care, pediatrics, and OBGYN. And so, we do everything. So we'll be talking about your functional health, but we'll also be diving in on your sniffles, ear infections. Well, some docs only cover the functional medicine side. If you get an earache or something, they'll have you see, urgent care or an ENT, something along those lines. Of course, I've seen an increase of even specialists because insurances are being difficult with all clinics now, not just primary care. And so I've seen endocrinologists who are completely concierge. I also have seen weight management specialists who are completely concierge. So that's kind of the 100% concierge side of things. There's also what would be called a hybrid style. So hybrid style of clinic would be where you have essentially one practice that runs the concierge side of things, and you would schedule appointments through that practice to do those specialized functional medicine things that are not covered by insurance. But then there's another business that would cover the things that insurance will pay for. Their rapid fire visits, their 5-minute visits, but also they can order your labs and things like that. And so you end up, the positive with that style of system is you end up being able to try to keep the out-of-pocket costs to a patient to a minimum with the membership style, but then also be able to leverage the insurance for what they will pay for, things that are quote unquote under contract with an insurance. And so that gives you some good flexibility. So I'm seeing this in the primary care world. I'm seeing this with a number of specialists as well, like I just mentioned, endocrinologists. I've also seen it with rheumatologists. More recently in my area, a spine specialty group has done that, where they're literally getting paid pennies for the office visit, but they get paid pretty well for the surgeries. So by insurance, that is. And so what they've done is they've said, okay, we're gonna have kind of a direct care model, cash style model for office visits, but then when it comes down to surgeries or big procedures, they leverage the insurance, they do that. And so there's a few different makes and models for the hybrid systems that are out there. But it just kind of depends on the situation. So that's kind of a brief overview. There's a lot of different ways that this could go, but hopefully it adds a little bit of light, answers a few questions for the different styles of concierge medicine that are out there nowadays. But yeah, we can get pretty granular on that. So I'll leave it at that right now. Beautiful, beautiful weather. Just loving this day. Hope you're having a good one out there as well. And yeah, hopefully you're getting outside and enjoying this a bit.